It is important for Suriname because due to the high burden of disease that we are facing in Suriname with regard to the NCDs, we have come to the conclusion that a integral approach to this problem is necessary. And with the health and all policies approach, we believe that outside of our sector with the other ministries, we can gain a higher return and greater success with fighting these diseases and getting a healthier population.
Health does not happen in a vacuum. Health is not the sole responsibility of the Ministry of Health, not even of the health sector alone. Health is the responsibility of everybody in the society, including the individual. We have been able to promote this approach in Suriname, and Suriname has taken ownership of the tool developed by the World Health Organization, the Health in All policy tool, within the determinants of health: social determinants, environmental determinants, economic and political determinants of health.
We have the insight, we have the information that we need to combine the efforts made in the different sectors. We need to have health in all policies so that moving forward with infrastructure, moving forward with social and education, we improve the health of our people.
Health in all policies is terrific. Even better is to have health equity in all policies, to look at the impact of policies not just on improving the average level of health, but improving the fair distribution of health, health equity.
The project of the First Lady, Boom Funderi project, is to prove that indeed we need a multi-stakeholder, the health in all policies approach, to ensure that children 0 to 3 get the integrated services delivered to them in such a way that it reduces morbidity and mortality.
We're dealing with community, we're dealing with service providers, we're dealing with policymakers. But we bring them together so that the information is fluid, going from one point to the other. We don't look just at, I'm only looking at health. No, I'm also looking at what's the education level, or if there is, for instance, domestic violence, what does that do to the mother, and why can she raise her child in a normal way? And what is the social burden she has to deal with, or what's the economic burden she has to deal with? And if you only look from health point of view, you don't take into account these things.
One of the ways to increase child survival and reaching health equity is by giving maximum attention to early childhood development. In fact, the ECD project, Boom Funderi, is an example of health in all policies.
The person that benefits from these services is approached more holistically. It's approached more holistically in the sense that you see the different aspects that is in the health services that we provide to the society, that we recognize gaps, that we see potential threats. These are all good benefits that you get from implementing getting a multi-sectoral approach. You can use structures that you have, you can do a fusion of different departments, you can get, with less budget, you can get more or better outcomes.
We have just finished some long discussions about the budget. And the first ministries that we start looking at are those ministries that provide the basic needs to the population. And we're talking about social affairs, we're talking about education, and we talk about health. and we make sure that all the needed health policies are being included in our budget.
Our adolescent program in Mungo is also integrated. There are 8 ministries involved in the adolescent program, and the priority areas are prevention of teen pregnancies and SID, the vocational training, and the school, having the children stay in school as long as possible. Violent behavior and domestic violence are, and also sexual violence against the children. And the last is sport and recreation.
We have to look at the big picture first before you make the plans. So where we want to go as a country is making sure that everybody has a fair chance to develop itself. And to develop yourself, one of the main things is you have to be healthy. So investing in the facilities, in training our people, and investing in working together, we make sure that hopefully the health situation of the country get better.
We have a lot of care, and this high cost care is because of the traffic accidents, road safety. But road safety is primarily for the Ministry of Justice and Police and for the Ministry of Public Works. But we feel the burden of unsafe driving, unsafe roads.
When you promote health in all policies, that not only I believe that within a few years, if you do it effectively, within a few years you will be seeing benefits from less of certain things. For example, a big example is people dying in traffic accidents. If it's a health issue, it's an accident, if we could convince other parts of government to do things differently, you might see a quick drop within a few years. You might see benefits.
Taking this health, all the health questions out of the medical model and looking again at social determinants and the burden of disease is also very important, because it's not a health thing only. It's much more than that.
It is a new way of thinking. So step by step, also for the policymakers themselves, you will recognize more ways in which to improve the whole approach of health in all policies and include it in your policies. It is not something natural. We have worked in another way for many decades, and so stepping into another direction will take effort, and this is a challenge.
Health in all policies is a great opportunity for Suriname. It will help the country move from addressing health prescriptions to addressing comprehensively the wellness of all Surinamese people.
PAHO and WHO will continue to provide the technical cooperation and support needed in the country for the next few years to fully implement this policy in Suriname.
At the policy level, I think with this program, I think we are really moving along, and we're really moving along very fast. And so I'm very grateful also that this is happening, because it also supports the project of early child development.
We've embraced the challenge of having Suriname be a pilot project in this approach. That means that it comes with also a great responsibility. This will also come with a long path of learning, and we see this as an opportunity to share these learnings with the other countries in South America.
And if we can introduce and get the benefits from this policy, that we get healthier citizens, healthier people, then all the other aspects will get more benefit.
If we keep going on this same way, we might end up with some disaster within the next 10 to 15 years. So I think that with the NCDs, the non-communicable diseases, the benefit will be big if we achieve the health in all policies. So we need to work at it.